let's move to endemic goiter. Goiter means enlarged thyroid, and there are several causes for goiter. The first and the main cause for goiter is iodine deficiency. Goiter occurs when iodine intake of less than 40 microgram per liter or water iodine content of less than 10 microgram per liter. This is the main cause of goiter. Other than that, goitrogenic substances can also cause goiter. So goitrogenic substances are the substances that will influence and disturb the generation of thyroid hormones. They include organic sulfates, organic compounds, and also inorganic compounds. Also, long-term drinking water of high hardness means that there are some other heavy metals in the water, will also influence the formation of thyroid hormones and thus cause goiter. And the other reason is the excess of iodine, because too much of iodine will reduce the peroxidase activity, and which in turn will decrease the generation of thyroid hormones. So let's now look at the pathogenesis of goiter. It's because, first of all, environmental iodine deficiency is found, and then causing or resulting in the insufficient iodine intake, so thyroid hormone synthesis is reduced. So the anterior pituitary secretion of TSH, thyroid stimulating hormone, will increase because there is a negative feedback here trying to compensate or stimulating more of the thyroid hormone synthesis. That resulting in thyroid tissue compensating hyperplasia and enlargement. And this will further resulting in abnormal thyroglobulin and accumulation in the glandular follicles, thus forming nodular goiter. So here there is a negative feedback regulation, because in our human body we're not like sit there still to be beaten, right? It's like during a fight, we are not sitting there or standing there stupidly and without moving to wait for someone else to punch us. Our body is trying to fight against the insufficient iodine intake or fight against the reduced thyroid hormone synthesis, and that's why it increased the secretion of TSH. However, the thyroid hormone synthesis was reduced because we don't have enough iodine, we don't have enough materials. So this increase of the secretion is not helpful, but even making things worse by the enlargement of the thyroid tissue and finally causing the nodular goiter. So the clinical manifestations are goiter, which we have already mentioned before, and this goiter will, because the goiter gets larger than it should be, right? I mean, the thyroid tissue becomes larger than it should be, so it will compress the surrounding tissue, including trachea, esophagus, recurrent laryngeal nerve, and other places. It looks like this in the X-ray picture. Other than this, there are also some ectopic goiter. This type of goiter means that the goiter is not formed in the thyroid tissue, but in other tissues like substernal goiter or in the neck within the chest. As we can see from here, it's here, not in the normal place that it will found. And this enlargement will result in the chest wall enlargement and skin petechiae and pulmonary atherosclerosis. So the diagnosis criteria of endemic goiter, first of all, the principle is that the patient has to live in the ward of endemic goiter or where iodine deficiency was found. Second one, this goiter has to be more than the man's thumb tip or less than the man's thumb tip, but accompanied with nodules. The third one is that we have to rule out the possibility of hyperthyroidism, thyroiditis, thyroid cancer, and other thyroid diseases. And fourthly, if we treat with iodine supplementation, we can see the thyroid uptake of iodine of isotope 131 rate was shown as a hunger curve. And this can be used as a reference indicator if this hunger curve was found. The hunger curve means that while we supply the patient with iodine 131, the intake of iodine is increased within 24 hours. It's like someone is very hungry, so that person will eat more when we give them the food, give the person the food, right? So that's why this is named as hunger curve. So the clinical classification are three types. First of all, the diffuse type. The diffuse type means that the thyroid increases the intangible nodules. So there's no, so those nodules are not easy to be found. And the second type is nodular type. So this is the mode where one or several nodules in the thyroid can be found. And the third one is the mixed type. That means that both the diffuse enlargement of the thyroid and the palpable nodules are found in the patient. This is very easy to understand. Diffuse type, nodular type, and mixed type. So for the diagnosis, there are different stages or different progression of the goiter. First of all, it's a simple goiter due to the negative feedback and the secretion of TSH. And then it's followed by hyperthyroidism. And then it's the subacute thyroiditis, chronic lymphocytic thyroiditis, invasive fibrous thyroiditis, and also thyroid cancer.